Welcome to the side event organized by ENCOD, the European Coalition for Just and Effective Drug Policies, and the non-violent Radical Party Transnational Trans Party NRPTT. Heroin and Ibogaine assisted therapies in the era of COVID pandemics. We start with Enrico Fletzer, an Italian journalist and president of ENCOD, who will give a short overview.
Just a few words before we start. North America and also some European countries have a great problem with the so-called opioid epidemic, which takes many human lives every year because of overdoses. Harm reduction programs and medical approaches are already used in substitution therapies like methadone, Suboxone, but there are other methods that might even prove to be more effective in treating opioid dependence in the long term, such as Ibogaine and Heroin Assisted Therapy. The speakers we invited today will talk about these different methods in more detail. In ENCOD, we believe that by regulating these alternative approaches, people who need them can get safe access to them, and that those who provide them can do so within a legal framework.
Let's welcome Dr. Massimo Barra, the International Federation of Red Cross and Red Crescent Societies, IFRC, Special Envoy on Health of the Foundation Villa Maraini of Rome and promoter of the Rome Consensus. It is an important contribution aimed at a more humane approach to the global drug policies.
Chair, dear colleagues and friends, it's a great pleasure to be here on behalf of the International Federation of Red Cross and Red Crescent, the largest relief organization in the world, present in 192 countries, well known for its protection and assistance activities in time of armed conflict as a neutral actor between the parties, and for its emergency intervention in peacetime in support of the victims of natural and human-made disasters. However, Red Cross and Red Crescent is less known for its action on drugs, despite the fact that the first resolution on substance abuse dates back on 1922, during the Bangkok Conference for Asian countries struggling with the harmful consequences of the abuse of opium. It is true that psychoactive substances can be consumed in the world to enjoy the positive or apparently positive effects for health. But it is equally true that millions of people get sick from the consumption of substances when they come to take them, not because they want to take them, but because they need to take them. Otherwise, they get sick. The suffering of people with drug disorders is still neglected and denied, and political authorities in many parts of the world underestimate this global impactful suffering. In fact, only 1 out of 8 people who need treatment for their disease can get it. This is a scandal, a true own goal for humanity. Not treating or placing obstacles in delivering the treatment of a person with drug disorder is one of the political attitudes that contribute most to worsen human suffering. The Red Cross is against all kinds of suffering. It is therefore against any prohibition of treatment that, based on scientific evidence, can improve the quality of life of a person with drug addiction, their family, and more generally of the entire humanity. Omitting or prohibiting treatment is a crime against humanity for which the guilty will, sooner or later, be called to respond. Punishment is not part of the treatment. On the contrary, it hinders it. Punishment and treatment are two different chapters that must not interfere, just as violence has no right of citizenship when it comes to treatment. Violence always brings more violence, and this world needs everything except more violence. Doubling the treatment everywhere and facilitate the access to recovery is a feasible and desirable strategy that would have immediate effects on the million of people affected and on decreasing the violence and anger that is destroying entire communities and which is the main issue linked to drug use and abuse phenomenon everywhere. As Red Cross and Red Crescent, we officially expressed our opinion and concerns on this issue to the Member States, with plenary statement and with a global humanitarian manifesto launched last year during the CND in Wien, already shared and signed by hundreds of organizations working all over the world to reduce the harm caused by drug abuse. The document, called the Rome Consensus 2.0 for a humanitarian drug policy, is available on the web. I hope that all participants in this meeting can read, share, sign, and spread it all over the world. Thank you for your attention.
We welcome Dr. Carla Rossi, former professor of medical statistics at the University of Tor Vergata in Rome.
Heroin assisted treatment involves supply of pure pharmaceutical diacetylmorphine to those who are dependent on the drug but have not benefited from the standard substitution therapies, utilizing mainly methadone or buprenorphine. It is currently considered a second-line treatment that assists people to escape the criminal entailment of addiction to street heroin and the health hazard associated with illicit drug use, such as the sharing of needles and the other injection paraphernalia that lead to the risk of infection with HIV, hepatitis C, and other viral illnesses. Doses are administered under direct supervision of medical staff. Switzerland was the country that provided the initiative underlying the form of heroin-assisted therapy treatment. The initial Swiss project for medical prescription of narcotics began in January 1994 and was supplemented by follow-up and further study, including to recruit heroin users who were not reached by the treatments. In order to attract these clients who were associated with HIV infection, crime, and disorder, the new treatment needed to be both readily accessible and to offer their intoxicant of choice, which was heroin. Although the country studies were subject to criticism as they were observational studies, they proved had more effective for engaging and treating street heroin users than the traditional oral methadone therapy. The benefit of HAT, consisting of removing people from the street heroin subculture and the criminality of it often entails improving their health, increasing social engagement, and reducing the impact of street heroin use on neighborhoods. The evidence base is very powerful and should lead governments to utilize HAT in the management of intractable heroin users for whom other forms of treatment have failed to work, as HAT has proven to be more effective in retaining people in treatment. HAT has proven to be more effective in reducing illicit street heroin use. HAT has proven to be more effective in reducing criminal activity. HAT has proven to be more effective in improving social and health functioning. Indeed, in the last 20 years, many clinical trials were also conducted on HAT to compare with some specific people using HAT or methadone, and show that such kind of people can be more saved using HAT. In particular, also many studies have been summarized in reports by RAND, and so if you want to go in depth, you can find those reports on website of RAND. We can also say that HAT saves money, because the relatively high cost per client is more than matched by saving across health, criminal justice, and other services that cannot be achieved with other treatment. It has been estimated that the 10% heaviest users of heroin in Switzerland fall into the HAT target group, consuming around 50% of all illicit heroin imported. As a result, the reduction in consumption of illicit heroin by those entering a program could substantially reduce the scale of the illicit heroin market, depriving organized criminals of resources. This is very important because it's also a goal that in the 2020 report of the Global Commission on Drug Policies, entitled Enforcement of Drug Laws, refocuses on crime gains, can be considered, and also can be readily verified on the basis of an OECD 2019 report that observed the second increase of problematic opioid use in OECD countries, showing a second epidemic wave of opioid use in all Western countries, whatever law and policy setting are in place. This means that HAT is more important to avoid the gains of criminal organization than any kind of drug policy. The most widely used opioid is indeed heroin. The second epidemic wave is evaluated using the indicator introduced by OECD. That means the difference between opioid overdose death in 2011 and opioid overdose death in 2016. The average value for the OECD countries providing data to OECD is 26.4. So this means that between 2011 and 2016, the number of overdose deaths for heroin and opioids increased of 26.4. So now it's very urgent to use HAT, as heroin assisted treatment is fully a part of the national health system in Switzerland, and locally it is applied also in Germany, the Netherlands, Canada, and Denmark. Further clinical trials on efficacies of ERT has recently been conducted in the United Kingdom, Norway, and Belgium, with the interest in using the therapy in those countries. The presence of COVID pandemic makes the lives of heroin and opioid-dependent users even more serious. So it's very urgent to extend in other countries the application of HAT to make the lives of these subjects better and more healthy by applying the therapy. And this is important also to reduce the contagion by therapy.
And now we have Dr. Sergei and Dr. Elena Khudoley of MedicoMente Clinic in Ukraine.
Hello, my name is Elena Khudoley. I am a doctor narcologist in Medical Center of Modern Addictology MedicoMente. I want to tell you about Ibogaine and its uses in complex treatment of heroin addiction. For today's situation with illicit trafficking of narcotic substances, psychoactive and psychotropic substances are more acute in the world. According to various sources, Ukraine takes fourth place in the world distribution and using narcotic substances. It's useful to note the traffic of narcotic substances from Asia to Europe through Ukraine is very huge. The application of synthetic medical opiates of methadone and buprenorphine legalized, like in European countries, have substitutional therapy. It helps to lead a person from street drugs, reduce the risk of infection, decrease the level of criminalization, and stabilized. But 500,000 officially registered drugs users, the state finances only 8,000 places of software substitutional therapy. And what is the result? There are a lot of recipes clinic where anyone for $10, $20 can get a receipt for analgesics and other substances, buy drugs legally. If you professionally approach the consideration of this issue, we can find some private drug clinic on the territory of Ukraine where patient can solve the problem of dependence and don't replace from one drug to other, but really heal a person. You can cope with addiction and former drugs addiction. Many read something used and describe the experience of using Ibogaine in the medical practice. Its unexpected psychedelic effects on the human consciousness and deep subconsciousness, on its use in the treatment of the people dependent of psychoactive substances and alcohol, on the treatment of people with severe depression and long, deep phobias. The recognition of the mistake of youth and the desire to know the truth change yourself. Uniqueness of the plant and alkaloids. First, the unique psychedelic effects. Second, all attempts and its selection on other territories was unsuccessful. Third, the creation of its synthetic analogs was unsuccessful. Fourth, Ibogaine doesn't form addiction. Respect, yes. Disgust, sometimes. Addiction, never. In medical practice, using of Ibogaine is often associated with the concept of the most effective methods of treating any opiates addiction. But as practice show, this technique is extremely effective in narcology, psychiatry, neurology, psychotherapy practice, psychedelic practice, the effects of Ibogaine on body cells. In what case, you can read additional in our presentation. All of us have repeatedly heard about deaths due to the use of Iboga, which was one of the facts in its prohibition. Ibogaine doesn't forgive a mistake and negligence. Its use sometimes can cause more harm than good, leading to irreversible disturbances and even death. Contraindication for use, selection criteria of procedure. Compliance with the selection criteria and exclusion. A detailed medical history, assessment of the general condition, physical examination, examination of organ and system, and mental state, testing for psychoactive substances. Apply exclusively to a clean body. Complete detoxification of the body from psychoactive substance, medications, drug, alcohol. Complete abstinence from past at least 7-10 days before Ibogaine session. Individual selection of the time and dose of the substances used. Using Ibogaine is possible only after complete stabilization of the body function. If contraindications are revealed, refuse the patient in the procedure. Thereby, you save his life and your medical reputation. Unfair service and provides. But don't forget, the effect of the procedure directly depends on what substances is used during Iboga session. In practice, Ibogaine is used in the form of root bark, total alkaloid, pure fat common alkaloid, and Ibogaine hydrochloride. Remember, Ibogaine is used exclusively in the form of the powder or grown bark, individually selected according to the patient weight for easy of use, placed in capsules. Ibogaine cannot be in the form of tea, liquid, solution, solid tablets, solution for intravenous or intramuscular uses. Today, Ukraine can be considered as a unique state, along with Canada, Brazil, and Netherlands, where the level of medical care is growing rapidly. Innovative methods and technological are applied. Ibogaine and medications based on it are not included in the list of substances prohibited or restricted for use and study in Ukraine. Of course, we cannot talk about all the institutes what use these methods in their practice in Ukraine, but we can share information about our clinic. MedicoMente, it's a medical center of modern addictology. We use comprehensive approach of treating patients with various types of chemical and non-chemical addiction, mental behavior disorders, rehabilitation, psychological support, along with other unique techniques. We intensively use Iboga therapy. The clinic is full provided with the entire list of model medical equipment for routine treatment and emergency care in an intensive care unit. There is always a complete list of certificate medication used to detoxify the body, relieve acute life-threatening condition, restore and stabilize of impaired body function. The clinic employs specialists in the following areas: anesthesiology, narcology, neurology, psychiatry, psychiatry, psychotherapy, psychologist. The center is licensed by the Minister of Health of Ukraine. Detoxification and preparation the patient in our center. Ibogaine therapy session in MedicoMente. cleans accommodation with further basic examination by the clinic specialist, related specialist, additional researches, consultation with the psychologist. In our clinic, a long session of iboga therapy is performed with ibogaine hydrochloride, 94% alkaloid, confirmed by spectral analysis. The dosage is calculated individually according to client body. We use exclusively ibogaine hydrochloride with spectral analysis. In our clinic, ibogaine therapy is used for mental and behavioral disorders due opiate use, alcohol consumption, psychostimulants, cannabinoid using, non-chemical type of addiction, gambling addiction, post-traumatic stress disorders, depression episodes and panic attacks, in the absence of psychopathological symptoms for spiritual growth. Why should iboga not be used on intoxicated body? Violation of intracardial conduction, intrapet living metabolism, the process of excretion by the kidneys are disturbed, disorders of neuromuscular transmission, cerebral intoxication and edema, cerebral dysfunction. Ibogaine session in Ukraine in MedicoMente during 6 days. Description of our days you can read on this slide. If the patient come to clinic on the background of exposure to surfactants or other health problem on the background of preliminary examination, additional detoxification, additional examination, and stabilization of the body can take 5-10 days. On this picture, you can see the review of our patient on our website and YouTube channel. We have more reviews of our patient, and you can see full review if you want. We have been a patient from a lot of country, and in the end of my report, I can say with confidence, the use of ibogaine therapy is the near future will occupy its fourth niche in various areas of evidence-based medicine, primarily as an integral component of the comprehensive treatment of additional problems. Thank you for attention.
And now let's welcome Jonathan Dickinson, Ibogaine advocate and director of Ceiba Recovery, Mexico and Canada.
Hey everybody, my name is Jonathan Dickinson. I am very happy to be invited today and honored to be able to share with you. I'll be speaking from my experience working around ibogaine therapy since late 2009. I currently work as a recovery coach and a consultant on different projects, mainly supporting individuals through follow-up care, through virtual intensive outpatient services, once people have been through ibogaine treatment. I've also worked as a community organizer and a researcher and served as the executive director of the Global Ibogaine Therapy Alliance. So one of the projects that I developed with them was a clinical guideline for ibogaine assisted detoxification, sort of consolidated knowledge from researchers, from physicians, from underground care providers, from various sources in order to try to address some of the cardiac issues and other preparation, screening, and monitoring issues that would help to mitigate risks of doing ibogaine, especially with the vulnerable patient populations that we see seeking ibogaine treatment. So I think that this document still remains a very useful resource for people in the field. I think that we have gradually, through this work and through the broader discussions, seen a drastic improvement in the level of care and monitoring that people do receive. And I think that while we haven't completely been absent of adverse events, they've changed in terms of where they appear and why they appear. So some of the more recent concerns are around treating people who are habituated to using fentanyl or other synthetic fentanyl analogs or other tranquilizers and things that are now found in street level opiates that are available to people. So one of the big questions that people always have when they're looking at Ibogaine is, does it work, or how well does it work? So there's one observational study that was put out by Thomas Kingsley Brown and others through the Multidisciplinary Association for Psychedelic Studies that compared itself to a number of different studies looking at long-acting opiates. So one in particular looked at buprenorphine taper protocols, which is a detox protocol that showed an 8.6% success rate, defined as people using for other opiates for less than 4 days in the previous month. There's also a bit of a comparison with opioid maintenance. So looking at the first month or 6 weeks of when people switch onto those programs. And then comparing to Ibogaine, we're looking at a pool of about 4 studies in total that have done observational work, 3 of them primarily with opiate-dependent individuals. And so there's different sort of results that you can see presented here, anywhere from 50% self-reported abstinence in 1 month to 50% at 1 year in New Zealand. There's probably numerous variables that influence these results. And again, we're looking at fairly small sample sizes. One thing that is interesting is Eduardo Schenberg and the research team in Brazil did show that, especially with cocaine dependent and crack or cocaine paste dependent individuals in Sao Paulo, Brazil, doing repeated treatments up to 5, I think was the most that they got to, did increase rates of long-term abstinence. So the lessons from the research show us that Ibogaine is an effective detox tool. It significantly helps to reduce opioid withdrawal, and it significantly helps to reduce cravings for other drugs. It doesn't do that universally at the same rate for everybody that takes it at all. People need to be sort of prepared for some level of discomfort. People have different needs afterwards in terms of what they need to do in order to sort of support that change, if that's something that they're really trying to anchor in, if abstinence is the goal. And so it's really important to understand that although we're comparing Ibogaine as a detox to treatment outcomes, we've seen that people that go and access treatment services or sober living environments or other recovery related resources do have an easier time making long-term changes. So to sort of further frame those results, it's not exactly a fair comparison to look at people doing buprenorphine or methadone programs against people that are coming to do Ibogaine. For one, people that are taking Ibogaine are often a highly willing patient population, paying out of pocket, traveling out of country. That's going to either mean a certain amount of financial solvency or family support. It also means that they're not being legally coerced to do it. In many cases, it's a violation of parole for individuals that are on parole to be able to travel that way. So, so there's a lot less extrinsic motivation although it's not absent completely. So we do see that many people who come arrive with a genuine desire to make a difficult life change. Most of them have found that, or many people have found that they haven't been presented with options to taper off of long-acting opioid maintenance programs like Suboxone and Methadone, and so they're seeking alternatives like Ibogaine. Also, in general, they're not being presented with sufficient detox options other than going into recovery programs, which are typically oriented around spiritual counseling and peer support, and don't provide the same level of physiological relief that people are looking for, which doesn't involve long-acting opiate maintenance in a lot of cases. So again, motivations do still include those kinds of extrinsic motivators like health-related and legal problems that are related with prohibition of drugs in the first place. So in terms of improving services in general, and where Ibogaine sort of fits into this, I think that the biggest change that we can see, which will not only sort of improve the health and legal status of people who use drugs in general, but also improve the safety of Ibogaine treatments for people who do want to have that option, would be to decriminalize drugs and to provide access to short-acting opioid maintenance. There's plenty of places in Europe, and there's some availability of that in Canada, but obviously in the United States, that's lacking, and in many other places, it's not available. We'd also like to see sort of access to better detoxification options, including those that are outside of industry and profit models, like vitamin C, which is cheap and readily available and extremely helpful, especially in IV therapy for people who are detoxing, as well as other education and resources to assist physicians in managing tapers from different things. I listed here benzodiazepines in particular because I feel like that's lacking. And then there's all kinds of research that I would like to see personally in terms of Ibogaine, including what is actually happening for people outside of just looking at abstinence outcomes, but what kinds of changes are we seeing in order to be able to target those services to the most appropriate people, rather than seeing like coercion into sort of a standardized treatment model that involves Ibogaine. I don't think that's the way to go. I also think that there's a massive benefit in improving models of peer involvement in treatments rather than placing it strictly into a medical framework, and looking at other things like inclusion of the arts, which is something that my good friend Dimitri Mouganis talks about frequently, I think is important to consider. So thank you again for allowing me to at least give a very brief introduction. And if you would like to learn more about Ibogaine, or particularly these sort of virtual intensive outpatient services that we offer, this is my site, and you'll find further resources there. So thank you very much.
And but it's maybe better to make a first set of questions and answers right now. I want to add a comment a bit. The heroin Ibogaine treatment is quite dangerous sometimes, so it must be brought out in a safer condition. The only problem is many countries don't recognize the use of Ibogaine in medicine, so there are also some underground providers. That's the case of Sarah Glatt, who's now in prison. She's claims innocent for having caused the death of a Swedish national. It's very important to make it in a safer environment, of course, but I think it's a good idea to force also the government to consider legalization of Ibogaine treatments, because in many countries, even substitution therapies are forbidden, and that is, as Massimo Barra said, something which is quite paramount and criminal. Okay, so I would pass to question and answers about the speakers, and then in case we have on the edge Mr. Jeffrey Camlet.
Karen posted one question in the chat. Mm-hmm. She's asking about if there is a sustained dialogue about Ibogaine with researchers from the Mediterranean, and that was directed to Jonathan, who is also not here in the chat, I think, or is he?
So Jonathan Dickinson is not here. So we will definitely pass this question on to him. And if you leave your email address here, we can give you the reply. But I have a question to Dr. Khudoley, to Elena or Sergei. I don't know. Are they here?
Yes, Sergei is here.
Sergei is here. Where is he? Okay. I would like to know, you said the clinic is, now I can see you. You said the clinic is run by Ukrainian state, yes?
Yeah.
Okay. And, but how is it? Can people from other countries come there? And how is this organized?
Okay, the first one, I tell a little bit about me. I am medical doctor. They have some anesthesiological, narcological, neurological, and organization the medicine. And during the long time, I am working in my town, and sometimes after the start war in my region, and for that time I must to changing my life and will go in some European country and start work. But I don't tell him for the clinic and nothing for the promotion the other clinic. And during 5 years I am working like doctor anesthesiological doctor who is do the detoxification from the opiates. And after some 5 years I'm back in my country, and in the 2018 we are start to opening some new clinic where we using some new treatments. And during that time we are do the next step. The first step, we have this. We are read the full information about the full psychedelic and other drugs in the Ukraine. After that, we are prepare our treatments plan and have some right position from the Ministers of Health of Ukraine. And now we open the right quality clinic. That first one. The second one about your questions. During the last 2 years, we are working the clinic, and we have some more patients from the other country. Why the patients? And if the possible, repeat some questions.
Sorry. I want to know if your clinic accepts people from foreign countries.
Look, and right now, on today, the come patients from the Greece. I have the more patients from the Italy, the 2 patients from Canada for the last 2 months. There's some patients from local patients. But now there's some difficult situation with the traveling. We are now in every country we have the like a lockdown, and the one country it is some easy with some little bit low situation. But before that, we are prepared for every our patients the innovation letter, and the patients coming in our country without any problem. But they must to do COVID test before traveling and have some insurance in the airport in Kiev.
Okay, that's very interesting. And
if we need, we send me some mail, and I'm send you more information about the treatments, about the patients traveling, about innovation, and about everything.
That's very good you mentioned this, because if anybody, you have a presentation, you send us a PDF. So if anybody needs the presentation, can we share it with the people?
It doesn't problem. We are publicate that presentation in our YouTube channel, and we are sent for you that information. It doesn't problem. I give you my agree and use my presentation.
Thank you.
But it's short information.
Okay, so I just put our email address there, office@encod.org. You can write us an email if you want the presentation. Maya wants to speak.
Yeah, I just wanted to mention that the whole presentation, the whole event will be published on our webpage, so it can be also viewed later, and we will also add there all the supporting materials.
Of course, that's a good idea. Are there any more questions? Okay, nobody wants to say anything?
Bye-bye, everybody.
Okay, Dr. Barra, thank you very much for your participation and for the work you're doing.
Thank you.
Very much.
Thank you very much.
We signed the Rome Consensus.
Thank you. Thank you.
Okay, so if there are no more questions, then I would say thank you for your participation. Thank you for your presentations to the speakers. And thank you for your patience to the audience, because, you know, if you want to avoid technical problems, there will always be technical problems. Murphy's Law. Okay.
If
Thank
possible,
you.
2 minutes, I want to listen about my idea. I think the many people who is stay in that conference know about Ibogaine, so more information. But I think nothing know about the mechanism for that Ibogaine drip. And now I finish my PhD. I think it's 5 of March. And after that, I want to prepare some laboratory where is we have some treatments for the animal, for the rat laboratory rats, and try have more pathophysiological mechanism about some Ibogaine treatment. What is our plan? We have some rats. The first one rats for the alcoholizated. The second one rats we do some opiates medication and some control group. And during the some time give the Ibogaine and try to see what is a really pathophysiological, pathogenetical mechanism of the Ibogaine. If we have the interest in for that information, I think I'm prepared some reports and explain about my idea. Who is want working together? We are open every time.
Thank you very much for this statement. So, any more questions to this, to Sergei's words? Okay. Farid, thank you. So, I will close the meeting now and stop the recording. Stop the recording.